Hi, my name is Jenna Nicoletti. I'm a nursing student from Indiana State University, and I'm doing this project on skin cancer for my community health class. I'm currently in LPN to BSN program. So, what population is at risk of skin cancer? According to American Academy of Dermatology, the population at risk is female before age 50 and male after age 50. And also, if somebody has lighter skin, they are more at risk for skin cancer because of the different factors related to the exposure to UV lights. After this video, you will be able to define skin cancer, identify cause and symptoms, identify risk factors, know how to prevent skin cancer, understand the diagnosis and treatment, and you know where to find the available resources. Now, please pause this video and just click the link down below in the description box to take a pre-test to test how much you know about skin cancer before we can move forward. So, what is skin cancer? Skin cancer is that skin cells grow abnormally, most caused by sun exposure. It can also happen to the area not exposed to the sun. Skin cancer most happen to the epidermis and dermis, which are outer and inner layers of skin. They mostly start in top layers of epidermis. There are three main types of skin cancers: squamous cells, basal cells, and melanoma. Squamous cells and basal cells are curable, but melanomas, if you cannot catch it early, it can cause death. So, what causes the skin cancer? Skin cancer mostly caused by the sun damage from the ultraviolet rays in sunlight, or the tanning bed, the sun lamps. It usually starts with a sunburn and then leads to the premature skin aging and the skin texture changing. So, what are the signs and symptoms? For squamous cells and basal cells, basically, just watch for any changes in the skin, a new growth, or there's lesion just never heal, or it's like painful and cause a lot of bleeding. For melanoma, we supposed to be able to recognize the warning signs of A, B, C, D, E's. So A symmetrical. That's for the shape. So it's gonna be irregular border. Pay attention to the mole with the irregular or jagged border. C for the color. Pay attention to the uneven color on the mole. For the diameter, basically just if the size is bigger than a pea, that's something you need to go to derm clinic to get checked out. And evolving. So basically, if there's any changes in size or shape, check it out. So what are the risk factors? Population with lighter skin, basically blue or green eyes, red or blonde hair, or if you get a sunburn, like super easy, have lots of moles on the skin, have the family history of skin cancer, have the history of skin cancer, or if you are in older age. So what can we do to prevent skin cancer? Try to stay away from sunshine. to limit the UV ray exposure, always wear sunscreen SPF 15 or higher every 2 hours if you go outdoors. Wear sun protection such as long sleeve shirts, pants, or hat with a bigger brim, sunglasses to protect your eyes. Tight woven fabric provides the best sun protection. Avoid tanning beds, sun lamps, sunbed, that kind of stuff. Have sun protection all year long, even it's raining or it's cloudy. And also avoid to go outside between 10 a.m. to 4 p.m. because the UV would be the strongest. Understand the UV light can reflect from water, snow, or sand. CDC recommends that wear skin protection, especially when exposed to UV index 3 or higher. Always self-examine your skin to get treated early if there's skin cancer. Keep your child younger than 6 months old inside from 10 a.m. to 4 p.m. or make sure they wear protection clothes if they have to go outside. So, what are the diagnoses and treatments available? Skin examination by a dermatologist to see if there's a skin lesion looks suspicious. If there is, they will do a skin biopsy to send a skin sample to the lab to examine see if it's cancerous or it's benign. If it is skin cancer, they will have excision to remove cancerous and surrounding tissues, or most surgery to remove the cancer cells and the surrounding tissues, but they will do it completely on the same day of surgery. EDNC, they will use cautery to remove the cancerous from the top layer of the surface. So that only works if the cancer cells is on the top layer of surface. Cryosurgery, they will use liquid nitrogen to kill the cancer cells. We have available resources such as American Academy of Dermatology, Skin Cancer Foundation, and the CDC. They all have phone numbers and websites you can get more information from. I also have some handouts available if you're interested to get more information about skin cancer. Now, please pause the video again. Just click the link down below to take a post-test, see how much you have learned from this video. Here are just the resources where I got my information from. Thank you for listening.